Treatment of Sleep Apnea. www.adultsleepapnea.com. Author's note. This ebook Treatment of Sleep Apnea is intended for informational purposes only. It should not be used as, or in place of, professional medical advice. Before beginning any treatment for sleep apnea or snoring, please consult a doctor for a proper diagnosis and remedy. If you are having problems sleeping, you are not alone. There are several types of sleep disorders as listed below. This book is going to concentrate primarily on sleep apnea with a side on snoring. However, I do feel it is important to be aware of the other sleep disorders that plague many, both in adults as well as children. At the end of this book, I have included some additional resources should you want additional information. In addition, you may want to check out my blog that contains a number of articles on this subject. Sleep apnea myths and facts. To become fully aware of recognizing and treating sleep apnea, one must be aware of the myths and facts attributed to this disorder. My research came up with the following. Sleep apnea is just snoring. Although snoring can be a sign of sleep apnea, there's a big difference between the two. People with sleep apnea actually stop breathing up to 400 times throughout the night. These interruptions last 10 to 30 seconds and are often followed by a snort when breathing resumes. This breaks your sleep cycle and can leave you tired during the day. Sleep apnea is not dangerous myth. All those interruptions in sleep take a toll on the body and mind. Untreated sleep apnea has been linked to job-related injuries, car accidents, heart attacks, and strokes. Sleep apnea blocks your breath. Fact. The most common type of sleep apnea is obstructive sleep apnea or Ursa. It happens when your tongue, tonsils, or other tissues in the back of the throat block the airway. When you try to breathe in, the air can't get through. Central sleep apnea is less common than Ursa. Central sleep apnea means the brain doesn't always signal the body to breathe when it should. Only the old get sleep apnea myth. Doctors estimate that more than 12 million Americans have Ursa. Although it's more common after age 40, the disorder can affect people of all ages. You're more likely to develop Ursa if you're overweight, male, African American, or Latino. The condition also tends to run in families. Alcohol will help you sleep. Myth. A nightcap may make you drowsy, but it does not promote good quality sleep. Alcohol relaxes the muscles in the back of the throat. This makes it easier for the airway to become blocked in people with Ursa. Sleeping pills have the same effect. Sleep apnea is rare in kids. Myth. Ursa is actually common in children, affecting as many as 1 in 10. In most cases, the symptoms are mild, and the child eventually outgrows the condition. But some children may develop behavioral issues or serious medical problems as a result of Ursa. Losing weight can help. Fact. You may be able to improve Ursa by making some changes in your life. If you're overweight, talk to your doctor about starting a weight loss program. Shedding even a small percentage of your body weight can improve your symptoms. If you smoke, ask your doctor about products that can help you quit. Lying on your side can help. Fact. If you sleep on your back, gravity can pull tissues in your throat down, where they're more likely to block your airway. Sleeping on your side instead may help open the throat. There are special pillows to help keep you on your side. Some people even use shirts with tennis balls sewn to the back. A mouthpiece works for some. Fact. A dentist or orthodontist can specially make a mouthpiece or oral appliance to ease mild sleep apnea. The mouthpiece is custom made for the individual and adjusts the position of the lower jaw and tongue. You put it in at bedtime to help keep your airway open while you sleep. CPAP is effective treatment. Fact. CPAP stands for Continuous Positive Airway Pressure. A CPAP machine blows a steady stream of air into the airway. The flow of air is adjusted until it's strong enough to keep the airway open while you sleep. CPAP is the most common treatment for adults with moderate to severe Ursa. Try surgery if nothing else works. Myth. In some patients, surgery may be able to cure Ursa. A good example is a child with large tonsils that block the airway. Removing tonsils can often provide a solution. In adults, surgery may improve symptoms by shrinking or stiffening floppy tissues. But this is not an option for everyone. Patients should consider the pros and cons and their doctor's opinion before going forward with a surgical procedure. Understanding sleep disorders. Some statistical information. A 2005 survey by the National Sleep Foundation, NSF, revealed that 75% of adults had at least one symptom of a sleep problem and that 54% experienced at least one symptom of insomnia. They either cannot get to sleep or cannot maintain being asleep. Some other statistics on the prevalence of sleep disorders include: it is estimated that 30 to 40% of Americans suffer from insomnia occasionally, with 10 to 15% having chronic insomnia problems. Some 40% of adults have a snoring problem, and they are not the only ones suffering, as their spouses also suffer disruption of their sleep. Between 2 to 4% of the population suffer from sleep apnea, a condition in which a person experiences pauses in breathing during their sleep. Another 5 to 10% of people have restless leg syndrome, RLS, a condition of unpleasant tingling sensation in their legs at night which can cause pain. An NBC News report on 4th of March, 2008 reported that 29% of the population find themselves sleepy at work. The same NBC report also revealed that 20% of the people said that lack of sleep resulted in less sex in their lives. The symptoms and effects of sleep deprivation. Sleep deprivation as a result of a sleeping disorder can have serious consequences. Sleep deprivation affects virtually all aspects of our lives, and some of the consequences resulting from sleep deficiency include the following. Insufficient sleep could result in obesity. Sleep deprivation could lead to diabetes. Other consequences of poor sleep include heart disease, high blood pressure and stroke. Your memory could be affected by the lack of sleep, and you may face potential concentration problems. People who have lack of sleep are more moody and irritable. There is a higher rate of accidents and injuries amongst sleep-deprived persons. Sleep deficiency also leads to lower efficiency and lower job performance. Marital and social problems could arise due to sleep deprivation. Some sleep disorders such as obstructive sleep apnea can be life-threatening. Common sleep disorders. Insomnia. This is the most common sleep disorder. It is characterized by the inability to fall asleep at night, or waking up earlier than you would like, resulting in an insufficient amount of sleep. Those suffering from insomnia do not feel that they have rested after their sleep. As a result, they may feel daytime fatigue and tiredness and are easily irritable, restless, as well as having feelings of anxiety and hence stress. Sleep apnea. Obstructive sleep apnea is characterized by obstruction of the upper airway during sleep, causing the cessation of breathing for 30 to 90 seconds at a time. This can happen as many as 600 times every night. The pauses in breathing are alternated by loud snores or brief gasps for air, and often with movements of the whole body. People who suffer from obstructive sleep apnea are extremely sleep deprived and often experience excessive sleepiness during the day. Snoring. About 40% of adults snore. Snoring occurs when your airway narrows to the extent that it causes the walls of your throat to vibrate as you breathe. If the airway narrows completely, breathing may stop altogether, as in sleep apnea, causing you to gasp for air and wake up temporarily. While simple snoring is not life-threatening, it can severely disrupt the sleep of your partner and may be worth treating. Narcolepsy. Narcolepsy is a neurological disorder caused by the brain sending sleep-inducing signals, resulting in recurring episodes of unavoidable sleep, literally, of sleep attacks. These attacks can occur unpredictably at times that may not be appropriate to sleep, such as while driving, having a conversation, or eating. Restless legs syndrome. This sleep disorder causes unpleasant aching, tingling or itching sensations shortly before or just after a person gets into bed. This causes an irresistible urge to move the legs. The person may experience pain and discomfort. Having restless legs syndrome or RLS may often lead to involuntary limb movements not only during sleep but possibly during the day as well. The sufferer may feel depressed and intensely anxious. Sleepwalking sleepwalking, or somnambulism, is the experience in which the brain remains partially asleep but the body is capable of movement and activity. This happens usually 1 to 2 hours after falling asleep. Sleepwalking can be triggered by emotional upsets, fever or sleep deprivation. Sleep apnea treatment. Sleep apnea treatment, overview. If you suffer from sleep apnea, then you will know that it is in fact a sleep disorder which often stops the breathing pattern during sleep. Each episode usually will last long enough to miss one or more breaths, and these episodes will often happen throughout the period of sleep. If you suffer from sleep apnea or you think your partner might suffer from it, then you will know that it can be a scary disorder which can often frighten witnesses, although most sufferers don't even know that it is happening to them. Sleep apnea usually isn't a dangerous disorder, although it can lead to broken sleep which can make the sufferer cranky and moody and tired because they are not getting enough sleep. Treatment for obstructive sleep apnea, OSA, includes lifestyle changes, continuous positive airway pressure, CPAP, to prevent the airway from closing during sleep, use of dental devices, oral breathing devices, to help keep your airway open, medicine to help you stay awake during the day, surgery. The goals of treatment are to relieve symptoms such as snoring and excessive daytime sleepiness and prevent other problems, such as high blood pressure. Your doctor will base your treatment on how severe your sleep apnea is. In general, your doctor will have you try lifestyle changes and PAP first. Surgery might be a first choice only if the sleep apnea is caused by a blockage that is easily fixed. You may need to be treated for other health problems before you are treated for sleep apnea. For example, people who also have inflammation of the nasal passages, rhinitis, may need to use nose spray to reduce the inflammation. People who have an underactive thyroid gland hypothyroidism need to take thyroid medicine. Children have the same treatment options as adults. But surgery, tonsillectomy and adenoidectomy, typically is the first choice because enlarged tonsils or adenoids cause most cases of sleep apnea in children. If surgery is not possible or does not work, children are treated using CPAP. Lifestyle changes. The first treatment for obstructive sleep apnea, OSA, consists of making lifestyle changes. Your sleep apnea may be helped if you lose weight, if needed. Small studies have shown that losing weight decreases the number of times an hour that you stop breathing, apnea, or that a reduced amount of air enters your lungs, hypopnea. Experts agree that weight loss should be part of managing sleep apnea. Wake up at the same time every morning. Sleep on your side. Try this: sew a pocket in the middle of the back of your pajama top, put a tennis ball into the pocket, and stitch it shut. This will help keep you from sleeping on your back. Sleeping on your side may eliminate mild sleep apnea. Avoid the use of alcohol and some medicines, especially sleeping pills and sedatives, before bed. Quit smoking. The nicotine in tobacco relaxes the muscles that keep the airways open. If you don't smoke, those muscles are less likely to collapse at night and narrow the airways. Raise the head of your bed 4 inches. 10 centimeters, to 6 inches. 15 centimeters. Put bricks under the legs of the bed. You can also use a special pillow, called a cervical pillow, when you sleep. A cervical pillow can help your head stay in a position that reduces sleep apnea. Using regular pillows to raise your head and upper body will not work. Promptly treat breathing problems, such as a stuffy nose caused by a cold or allergies. Some people use nasal strips, which widen the nostrils and improve airflow. Although these strips may decrease snoring, they cannot treat sleep apnea. First medical treatment. Continuous positive airway pressure, CPAP, is nearly always the first medical treatment for sleep apnea. With CPAP, you use a breathing device that prevents your airways from closing during sleep. CPAP is the preferred treatment for moderate or severe sleep apnea. It may take time for you to be at ease when you use CPAP. You may find that you want to take the mask off, or you may find it difficult to sleep while using it. If you can't get used to it, talk to your doctor. You might be able to try another type of mask or make other adjustments. CPAP does not always get rid of daytime sleepiness. If you still feel sleepy during the day while using CPAP at night, tell your doctor. Some CPAP devices automatically adjust air pressure or use different air pressures when you breathe in or out. They are easier and more comfortable for some people to use. Other medical treatment includes oral breathing devices. These devices reposition your tongue and jaw during sleep, which opens up your airways. Surgery might be the first treatment only when a blockage can be fixed easily, such as when you have overly large tonsils. CPAP, one of the most well-known treatments and which is also one of the most effective sleep apnea treatments, is the use of a continuous positive airway pressure, which is also known as the CPAP device. This type of sleep apnea treatment works by splinting the airway of the sufferer, keeping it open during sleep by a flow of pressurized air into the throat. This device helps with assisting patients who are suffering from sleep apnea to inhale but not exhale. However, there is another device called the Bipap machine which can assist sleep apnea sufferers with both inhaling and exhaling and is often used in more severe cases. As well as the CPAP and the Bipap machine, other sleep apnea treatments can come from a dentist who specializes in sleep disorders. They will be able to prescribe a sleep apnea sufferer with something called oral appliance therapy, also known as Elton. This comes in the form of a customized mouthpiece which is fitted only for the sufferer, and it works by shifting the bottom jaw forwards, which in turn helps to open up the airway. This type of treatment is often rather successful, especially in sufferers who have only mild or moderate symptoms of sleep apnea. This is quite a new treatment which is becoming quite popular with sleep apnea sufferers, but it has been commonly used in Europe for quite some time now. One thing which you can do to help yourself if you are a sufferer of sleep apnea is to lose weight. If you are overweight, then this can affect your symptoms and can sometimes even be the main cause of sleep apnea. By losing weight, if you need to, and keeping an active social life and exercising regularly, you could help to treat your sleep apnea the natural way without having to use anything else except for your own willpower. If you are overweight, then losing any excess weight will not only help the symptoms of your sleep apnea, but it will also make you feel a lot healthier overall. Sleep apnea treatment, mild cases. If you have been having some difficulties sleeping, or you have been suffering from interrupted sleep, then you could be suffering from sleep apnea. This sleep disorder is actually quite common and it is usually affected by age and weight. If you are heavily overweight, then it is often more common and can affect you dramatically. Sleep apnea will cause a sufferer to stop breathing for one or more breaths throughout the night, and whereas most sufferers do not even realize it is happening, for the partner of a sufferer it can be quite scary, and it can end up disturbing both your sleep and the person you share a bed with, leading to crankiness and tiredness. But there are a lot of ways that you can treat sleep apnea so that you can get a good night's sleep and not worry about disturbing your partner. Your first step when it comes to sleep apnea treatment is to get diagnosed. This is usually done through a sleep clinic where you will be monitored during a period of sleep so that the condition and the severity of the disorder can be determined. There are many different kinds of sleep apnea treatment available, but if you are only suffering from a mild case, then there are some easy treatments which you can do for yourself which do not involve having to take medication or surgery. Their first and most effective sleep apnea treatment in mild cases are, if you are obese or overweight, to lose any excess weight. This will help to keep your airways clear, and it will also make you much healthier in the long run. Losing weight can really help the symptoms of sleep apnea, and it will also help your body to remain healthy if you keep active. Another effective sleep apnea treatment in mild to moderate cases is simply to invest in a special pillow which will keep you sleeping on your side. This is because most attacks of sleep apnea happen when you are lying on your back and your airway closes, but if you invest in one of these pillows, then it should help to reduce the symptoms of sleep apnea dramatically so that you and your partner can sleep soundly. Perhaps a more radical sleep apnea treatment is learning to play the didgeridoo. In 2005 a study was carried out on sufferers of sleep apnea and snoring, and it was found that playing and learning the didgeridoo helped to reduce the effects of these conditions. It was found that it helped to strengthen muscles in the upper airway so that they were less likely to collapse during sleep. It was also proven in this study that it could help to stop daytime sleepiness as well. So you not only get to learn a new and fun instrument, but you will be treating your sleep disorder as well. Sleep apnea treatment, severe cases. If you suffer, or think that you might be suffering from sleep apnea, then you might be wondering what type of sleep apnea treatment is best for you. There are many different types of treatments which can help with this sleep disorder which causes the sufferer to stop breathing on and off during sleep, but the treatment all depends on how severe each case is. A lot of sleep apnea sufferers tend to have very mild symptoms and will not even realize that it is happening to them. They might just feel a little tired in the morning from waking themselves up during the night, but in more severe cases sleep apnea can lead to a lot of complications. This is why sleep apnea treatment is very important. One form of treatment for this disorder which has been proven to be one of the best forms of treatment is the Bipap device. This is a device which the sufferer will wear during the night, and it helps to keep the airways open and it will assist the sufferer in inhaling. Also available is the Bipap device, which does the same thing, but it also helps you to exhale as well as to inhale. These two devices have been proven to be very effective in sleep apnea treatment, but it is not for everyone. It all depends on your particular view. Another device which has been proven to help treat sleep apnea is oral appliance therapy, or OAT as it is more commonly known. This is available from dentists who specialize in treating sleep disorders, and it is a mouthpiece which is custom made to fit each individual. Worn during the night, the OAT device helps to lower the bottom jaw so that airways stay open during sleep. This sleep apnea treatment is brilliant and it is a great way of treating the symptoms. However, if you are suffering from a very severe cause of sleep apnea, then you might wish to try surgery. Surgery for the treatment of this disorder is usually only done if you have already tried and exhausted all other treatments, or if you are suffering from a very severe case in which you are hardly sleeping at all. Surgery for the treatment of sleep apnea can vary from case to case, but the most common form of surgery includes the correction of the nasal passages and the throat. In more serious cases, sometimes the facial skeleton will be altered by a technique called maxillomandibular advancement, see below for more info, in which the upper and lower jaw will be altered. This is usually only explored if other surgery has failed. If you want to find out more information on the options available to you, then it is advised that you speak to your general physician, who will be able to advise you on the best course of treatments and action. You can also find out more information about sleep apnea and treatments in the resources section at the end. Mandibular appliance. When it comes to sleep apnea treatment, there are over 70 types of oral appliances which have been designed to treat this sleep disorder. As well as oral appliances, other forms of treatment for sleep apnea include surgery, medications such as acetazolamide, which helps to lower the pH level in the blood and in turn encourages respiration, and low doses of oxygen during the night as well. There are so many different treatments available that it can be difficult to know which type of treatment is the best one for you. It all depends on the severity of the case, and treatment is usually different in each person. It all depends on your individual needs. One such sleep apnea treatment is by using the mandibular repositioning appliance. This treatment has been specifically designed to move the lower jaw down and forward when the mouth remains closed during sleep. In most cases of sufferers using this type of sleep apnea treatment, it has been proven that the airways remain open to stop the effects of sleep apnea. Most of these mandibular appliances tend to have an upper and lower compartment, and these are attached to one another by elastic of a type of screw-like retaining device. Some of these appliances come with upper and lower compartments, and some only come with an upper compartment. Some of these appliances with no elastics or screws have actually been proven to stimulate the bone growth in the jaw, which can eventually lead to a permanent change in the bite. However, even though there are downsides to using this device for sleep apnea treatment, there are some major upsides as well. Because it can help to keep the airway open during the night, it could end up getting rid of your symptoms of sleep apnea altogether. If you don't like the idea of the mandibular repositioning appliance, then there is another similar device which can have the same type of effects as the mandibular appliance, which is called oral appliance therapy or OAT. This therapy can be custom-made by any dentist specializing in helping to treat sleep apnea and other sleep disorders, and it is custom-made to fit your mouth only. It helps to push out the jaw so that when you are asleep it opens up the airways so that it limits the effects of sleep apnea. You can find out more information about the mandibular repositioning appliance and the OAT from your dentist or your physician, who will be able to advise you on the best sleep apnea treatment to suit your specific needs. You can also find more information on sleep apnea and how to treat it on the internet, so that you are able to understand the disorder more if you are a sufferer or have a loved one who might be suffering from sleep apnea. Sleep apnea treatment, surgery. Sometimes, cases of sleep apnea can be quite severe, and non-surgical methods have been tried and tested. If you are suffering with a severe case of this disorder, then you might be wondering what options you have left. Well, there is no need to despair, because if you find that other treatments have failed to work, then surgical methods can be used to alter the airway. With this type of sleep apnea treatment, levels of obstruction will be addressed, such as the throat and nasal passages, the facial skeleton and the base of the tongue. Surgery for obstructive sleep apnea, OSA, is usually not done unless other treatments have failed or you are unable or choose not to use other treatments. Surgery choices. Uvulopalato-pharyngoplasty. Removes excess tissue in the throat to make the airway wider. It is the most common surgery to treat sleep apnea in adults. Tonsillectomy and/or adenoidectomy. Removes the tonsils and/or the adenoids. It is an option if you have enlarged tonsils and adenoids that are blocking your airway during sleep. This is often the first treatment option for children, because enlarged tonsils and adenoids are usually the cause of their sleep apnea. Other surgical procedures are used to repair bone and tissue problems in the mouth and throat. Tracheostomy. Creates a hole in the windpipe, trachea. A tube is then put in the hole to bring air in. Doctors rarely use this surgery because it may cause other health problems. But when other techniques have failed, almost all people who are treated with tracheostomy will be cured of their sleep apnea. Bariatric surgery is done for weight loss. If you are extremely overweight, severely obese, and the excess weight is making your sleep apnea worse, you may consider surgery to help you lose weight. Bariatric surgery can promote weight loss that improves sleep apnea. Surgery for children. Tonsillectomy and/or adenoidectomy usually is the first choice for children, because enlarged tonsils or adenoids cause most cases of sleep apnea in children. Other types of surgery may be needed to correct birth defects that can cause sleep apnea symptoms. Snoring. Quotable thoughts on snoring. Laugh and the world laughs with you, snore and you sleep alone. Anthony Burgess. There's only one cure for snoring, insomnia. Anonymous. There ain't no way to find out why a snorer can't hear himself snore. Mark Twain. My husband's snoring is not always so bad. Sometimes it drowns out the noise of passing trains. Anonymous. Snoring, on the funnier side. Snoring has been the brunt of many jokes, but it is no laughing matter. Snoring affects persons of all ages, but particularly middle-aged and older persons. It is estimated that over 50% of adult males and 30% of adult females may be affected by snoring. But, I did ruin across this one and thought it served some press here, as it appears to be #1 on the internet. This joke is the most popular on the internet. By the time a Marine pulled into a little town, every hotel room was taken. "You've got to have a room somewhere," he pleaded. "Or just a bed, I don't care where." "Well, I do have a double room with one occupant, an Air Force guy," admitted the manager, "and he might be glad to split the cost. But to tell you the truth, he snores so loudly that people in adjoining rooms have complained in the past. I'm not sure it'd be worth it to you." "No problem," the tired Marine assured him. "I'll take it." The next morning the Marine came down to breakfast bright-eyed and bushy-tailed. "How do you sleep?" asked the manager. "Never better." The manager was impressed. "No problem with the other guy snoring, then?" "Nope, I shut him up in no time," said the Marine. "How do you manage that?" asked the manager. "He was already in bed, snoring away, when I came in the room," the Marine explained. "I went over, gave him a kiss on the cheek, said, 'Good night, beautiful,' and he sat up all night watching me." General information on snoring. Snoring is normal. This is a very wrong belief by almost every individual. Not all people who snore are free from any disorder or illness. Excessive snoring is a major symptom of sleep apnea, or you might have other health problems. If you're a snorer, the first thing that you should do is to seek medical help from professionals. They can assess the underlying cause or causes of why you snore. Snoring is a terrible sleeping habit. It accounts for the many sleepless nights to the one who hears it. There are a lot of natural snoring remedies available in stores in almost any part of the world. But before using any of these products, ask your doctor firsthand. There are factors which can add to the frequent snoring that bothers you every night. Some of these factors are: 1. A room full of dust and fur. It is best if your bedroom is well ventilated, free from dust, and the beddings are always kept clean. 2. Health problems like obesity. If you're obese, you'll experience breathing problems, especially when you're lying down. 3. Milk and wheat allergies. These types of allergies can lead to phlegm buildup when you don't do something to resolve the condition, which interferes proper breathing. 4. Smoking. After a long period of time you can develop lung problems. 5. Excessive alcohol intake. Alcohol is good for the body when taken in minimal amounts, in longer intervals, but excessive drinking slows down the processes inside the body and also hinders proper breathing. Think about the 5 factors, take note which one affects or adds up to your snoring. But no matter what natural remedy you use, the snoring will not go away. Why? If you want to relieve or remove snoring entirely, you should also make adjustments in your unhealthy lifestyle. Blocked nasal passages cause snoring, and if you use natural remedies for snoring, what it does is break down obstructive substances like mucus. Natural snoring remedies consist of herbs like bromelain, undeveloped bitter orange, and other herbs which maximize the airflow. Natural remedies can be in pill form, nose drops, or it can also be a spray. Some natural remedies make use of enzymes from different plants like protease, lipase, amylase, and cellulose. These enzymes open your sinuses, which can actually resolve snoring. The effectivity of these natural snoring remedies is not guaranteed because most of them are not FDA, Food and Drug Administration, approved. But still, a lot of consumers claim that these remedies are highly effective in eliminating or reducing snoring. More often than not, you should experiment with different natural snoring remedies before you can actually find one which suits you best. This step is ideal, although a bit time-consuming, but once you find the right remedy, All you have to do is to continue using that remedy. If after some time of using natural snoring remedies proves to be a failure, you must again talk with your doctor. Tell him all your concerns, as well as what remedies you have used for the last few weeks or months. Your doctor is the only person who can assess your condition. Consider him/her as a best friend. Never hesitate to seek for help. Snoring is one disorder that you should not be disregarded. It needs attention and proper medication or surgery. Its causes are various as are its effects. Sleepless nights, personality changes, lack of concentration and exhaustion are just a few of the results of snoring. Information on snoring is widely publicized, but it can be difficult to find all of the needed information in one article. This article is geared toward every aspect of information on snoring, including its causes, remedies and potential problems. There are several factors that are believed to contribute to snoring. For example, obesity is one of the leading causes and is, therefore, one of the cures. If you are overweight, or have recently been diagnosed with obesity, a well-balanced diet and exercise program may help you to stop snoring. Many studies and information on snoring also suggest that individuals who regularly sleep on their back are more likely to snore than those who do not. By sleeping on your side, you will lessen the chances of having the muscles and tissues relax to the back of your throat and restrict air passages. This often leads to snoring, which is why sleeping on your side may help to correct the problem. If side sleeping just isn't possible, information on snoring also suggests that sleeping on two pillows instead of one may help to keep airways unrestricted and eliminate snoring. The use of alcohol and cigarettes are also thought to increase the likelihood of snoring, which is one of the many reasons that snoring sufferers are urged to discontinue their use of these products. Cigarette smoke is just one of the allergens that may cause breathing problems. Information on snoring suggests that allergies may contribute to snoring, as well. When breathing becomes restricted, which is very often the case with allergies, sinuses or a cold, snoring may result. In an effort to avoid this, information on snoring suggests that ridding your home of allergens is a good idea. The use of air filtration units in every room, along with regular cleaning, will help to eliminate pet hair, dust, cigarette smoke and other airborne allergens. If you have tried every remedy possible, but you still require more information on snoring due to lack of results, consult a physician for the potential presence of sleep apnea. This disorder occurs when air passages are completely blocked and the sufferer actually stops breathing on multiple occasions during the night. Information on snoring suggests that pauses in breathing, excessive snoring and ineffective remedies are all symptoms of sleep apnea. This disorder must be treated effectively in order to avoid further complications, such as heart disease, a stroke or other serious medical condition. Snoring problem, physical and emotional symptoms. The physical symptoms, one of the very strange challenges that the entire topic of snoring faces, is that, well, most people don't think it's all that big of a problem. As a result, many people are quite skeptical when told that snoring is a severe physical and emotional health problem. It only takes a minute, or a cursory glance, at the list of physical symptoms associated with a snoring problem to quickly embrace this funny-sounding noun/verb into the class of serious health problems. Here is just an opening list of the health concerns that could occur from snoring problems, and remember, please, that we're just looking at physical snoring problems right now. Emotional problems come later. Sleep apnea, heart disease, stroke, headaches throughout the day, due to poor quality sleep and poor airflow through trachea. Night sweats, heartburn, swollen legs and arms, due to lack of oxygen flow. An overall weakened immune system, hearing loss. If the snoring problem is very loud, remember, snoring can be as loud as a passing jet. And more. In addition, most of us assume that snoring problems are associated with adulthood, and, as such, that the physical ailments noted above are limited to adults. This is not the case at all, since many children and adolescents snore, particularly those with related airflow inhibiting conditions, such as asthma. If you, the reader, are not a snorer, but have lived with, or currently live with, a first-class snorer, you might find yourself shedding a tear or two as you read this section. That's because often overlooked in the whole snoring discussion are those people who don't snore. These are the husbands, the wives, the kids, the nanny, the siblings, the in-laws, and even the neighbors who have found themselves on the receiving end of a chainsaw, or a lawnmower, the sounds of a snorer, that tended to start at around 10 p.m., and continued, unabated, until about 7 a.m. the following morning. For such people, trying to fall and stay asleep was not merely an exercise in stress coping, it was an exercise in crisis management. The emotional symptoms. It's not at all overly dramatic to suggest that the emotional costs of living with someone with a snoring problem are as severe, or possibly even more severe, as the physical toll associated with snoring problems. This is because snoring can lead to a disturbing array of emotional problems, including lack of sleep, leading to depression and anxiety, marital breakdown and divorce. Due to lack of sleep and lack of empathy, remember, the partner with the snoring problem doesn't often know the pain that they are unwittingly causing. Eviction by a landlord and the resulting humiliation. This may sound funny, but some people have literally been kicked out of their homes because of their snoring problem. Warring roommates and neighbors, job loss, due to inability to concentrate and focus, because of sleeplessness. Memory and retention problems due to sleeplessness. And within these problems, and this just a simple list, an entire book can be filled to document the real-life emotional damage caused by snoring, are a host of painful mental states that infect both the guilty snorer, and the enraged non-snorer. These unproductive emotional states include frustration, anger, feelings of violence, helplessness, desperation, frustration, exhaustion, growing resentment, lack of confidence and self-esteem. And let's not forget the millions of non-snorers who drive cars or operate heavy machinery. Without a solid night of sleep, some of them can, and regrettably do, put both themselves and others at risk. Indeed, the emotional problems associated with snoring are, unfortunately, less discussed, especially since the snorer himself or herself isn't aware that he/she is causing so much unintentional emotional damage. Yet, as you can easily see, perhaps even in reflecting upon your own life, the emotional costs of being a snorer or living with someone who has a snoring problem. Snoring by nature is. There are over 300 anti-snoring devices invented since the first innovative tennis ball in a sock, which by the way primarily helps prevent patients from sleeping on their backs. Other devices, however, initiate unpleasant stimuli every time a person snores. However, it must be noted that snoring is not subjected to our voluntary faculties. If one device really does stop you from snoring, then it might be credited to the fact that you were kept awake all night without one sweet dream. It all lies in the abnormality of the air passage. Free flow of air is needed to facilitate regular breathing. With problem snoring, it is likely that any part of the area at the back of the mouth and the nose strike constantly. Thus, the vibration in breathing. It may be that some people consider snoring as a non-serious condition, but in fact, the opposite is true. People who suffer from snoring normally have disrupted sleep that deprives them of having normal uncomfortable sleep. And when the condition gets aggravated, the snorer normally will have long-term health problems, including obstructive sleep apnea. And besides, this actually causes patients embarrassment and oftentimes affects another person's sleep. Obstructive sleep apnea, on the other hand, is the condition by which snoring is constantly interrupted with total obstruction of breathing. This occurs at an average of 10 seconds long and may happen at around 7 times in an hour. Thus, the patient may suffer from 30 episodes up to 300 episodes in one night alone. Such episodes will reduce the level of oxygen in the blood, which drives the heart to pump harder. Immediate effects include a forced light sleep so that he may keep his muscles in tensed state. This will help facilitate a regular flow of air in the lungs. This then results to unrelaxed rest. Thus, throughout the day he will become sleepy, which causes him not to function well. This then will contribute largely to the enlargement of the heart and raised blood pressure. There are various contributors on the severity of snoring. These include: mouth anatomy. Snoring usually concerns the tissues involved in breathing. There are a couple of reasons why the air passage is narrow, which is itself a good contributor to problem snoring. This may be due to enlarged tonsils, elongated soft palate and thick soft palate, and abnormality in the tissues at the back of the throat. These can all cause obstruction in the air passage. Alcohol consumption. Factors that can help relax the muscles of the throat more are effective causes of snoring. Due to the fact that alcohol is a sedative substance, it acts upon the muscles in the throat as a relaxant. Thus, regular intake of alcohol during near bedtime can cause disruptive snoring. Sleep apnea. More often than not, snoring is associated with obstructive sleep apnea. It is best that you are well diagnosed so that due treatment can be processed. Nasal problems. It may also be that biological factors can intrude to the normal passage of air in your throat. The underlying part of the nose, termed to as the bridge, is the nasal septum. When this partition is quite crooked or there is any nasal congestion due to this, snoring would occur. As we have earlier mentioned, there are so many attempts to set off snoring. However, one of the most effective is the surgery, in which permanent treatment is applied. If you are a sufferer from snoring, it is best that you get early diagnosis. While it may not be a life-threatening condition, it is still very likely that your condition get. Determining the cause of snoring. Many things promise to cure it, but what exactly causes snoring? This may be quite a hard to answer question when we are talking of only one cause. For in fact, there are many basic contributors that all funnel into the greater source of the problem. The cause of snoring varies from one individual to another, but there are several leading factors that are believed to be behind this nighttime nuisance. Obesity is believed to be a leading cause of snoring. Many physicians, therefore, recommend a program of diet and exercises in an effort to not only prevent snoring, but also to promote better health. If you have recently been diagnosed as being either overweight or obese, it may be time to consider a quality program to help shed some pounds along with your snoring habit. Another main cause of snoring is when individuals sleep on their back. When this happens, the muscles and tissue tends to relax in the back of the throat and restrict air passages. By sleeping on your side, you may help to eliminate this problem and greatly reduce snoring. The aging process is believed to be another cause of snoring. Researchers believe that, as the skin in the throat ages, it begins to lose its elasticity. When this happens, it is more likely to relax and cause air passages to be restricted. Sleep apnea is a disorder that is also a serious cause of snoring. Symptoms include excessive snoring, pauses between breathing, awakening through the night with a feeling of choking or gasping for air, etc. If left untreated, this ailment may lead to more serious medical conditions, such as heart problems, a stroke or other illness. Sleeping on your back, the tissue in the back of the throat tends to relax and often restricts the airway. When this occurs, snoring may be a result. Therefore, side sleeping is a possible remedy. Medically, snoring is defined as a noise caused by vibration from the airways of the respiratory tract that only appears during sleep. The big question here is that, why, of all state, do we only experience snoring during restful moments? Well, while we breathe 24/7, the likelihood that one snores during waking hours is very slim. This is due to the factor that only relaxed muscles can result to snoring. During sleep, all our voluntary muscles are relaxed. The throat, in the same way as the triceps are relaxed, is also resting while we sleep. The fact that tissues in the throat are soft, adds to the eventual output of vibrating sounds. Once this tissue eases out, the passage of air will turn into a narrower passage. As you can see, narrowed passages causes louder noise because there is more room for friction, thus the vibration. These same factors are also pointed as the reasons why there are differences in the loudness, pitch and tone of snores. The loudness of snore is affected by the force of the wind that comes through the air passages. Therefore, when the speed of wind is faster, the snore, in general, is louder and more resonant. This answers why babies are capable of snoring too. However, theirs is not typically considered as snoring but only as mild noises created by the respiratory tract. This must never be ignored though, since it may be the early sign that something is jammed in your child's respiration tunnel. But while it may appear to both genders at any age, men are more often affected by this condition than women, and middle-aged men are most likely to be the victims. This is due to the reason that men have more fleshy necks since theirs are a bit wider than women's. This factor combined with the speed of air, the result is most likely to be snoring. Meanwhile, women by nature produce progesterone hormones. This is known to inhibit snoring, thus they are less susceptible towards the irritable sounds. Because this actual hormone helps in relieving a person from this nighttime dilemma, some anti-snoring devices are known to use progesterone as their basic ingredient. Lifestyle and health factors are also thought of as culprits of snoring. These include allergies that cause clogs in the air paths, drying of the nasal cavities due to several elements including allergy medications, cold and flu. This explains why some people only experience snoring when they are sick. Excessive intake of alcohol, thickening of the tissues along the nasal passage. Often, surgeries done on conditions not directly related to snoring can also contribute to the frequency and intensity of the snores. Abnormally large belly or guts. Irritation of the air passages due to overuse of nasal sprays. Abnormal enlargement of the tonsils or the adenoids. Smoking, which causes inflammation in the air passages. Swelling of the thyroid gland or goiter. Blockage of the airflow due to large tongue. Medications that initiate relaxation. Obesity. Inefficient neural control on the nasal membranes. A sleep study, which is generally ordered by a physician, may help to diagnose the direct cause of snoring for each individual. The snoring sufferer spends one night at a sleep center, which monitors his/her breathing and snoring patterns throughout the night. The results are then studied by a physician who makes a final diagnosis. Finding treatment for snoring through surgery. Snoring is among the most common sleep problems. While it is neither a debilitating nor death-threatening condition, it still causes some grave problems that may or may not directly root from its effects. Most middle-aged men are the victims, and there is high risk towards obese persons. This is true since fleshy necks are most likely to have more muscles that would collapse during relaxed breathing. Snoring roots from narrowed air passage in between the throat and the nose. When we sleep, this passage narrows due to relaxation of the tissues. This explains why we only snore when we are at our most restful position. With a narrowed passage, the pressure of the air from the mouth and back are highly increased. Thus, this will drive the flapping muscles to vibrate more, which in turn create the snoring sounds. Anything that helps narrow the air passage and the muscles to relax will most likely initiate the vibrations. Say, substances that promote muscle relaxation will encourage the tongue to fall back or the throat muscles to be relieved from tension. Stuffy nose can also be considered as a culprit since it limits the space in which air can pass through. Thus, there are specific cases of snoring that only occur when one has colds or inflamed sinuses. Snoring can also be attributed to the position by which the patient sleeps. Sleeping on one's back will cause your tongue and throat muscles to be pulled back by gravity. Therefore, patients are advised to get used with a sideward sleep position. since the only problem here is the unwanted relaxation of the muscles and tissues lining the respiratory tract, specifically the throat and the nasal passages. The most possible cure is to repair any excess muscles. An otolaryngologist will help determine what truly causes your snoring problem. He is a specialist in conditions that are directly linked with ear, nose and throat problems. He is the only authority that can create a thorough examination of your condition. The traditional method of surgery for snoring is the uvulopalatal hairangoplasty or UP, which aims to widen the air passages. This process normally removes excess tissues that cause the narrowing of the throat, including uvular tissue, adenoids, tonsils and those that are covered by the pharynx. The more intensive version of this method, called laser-assisted uvulopalataloplasty or LOP, uses laser in the removal of the muscles that inhibit normal air passage. Both methods normally work best for mild snorers and don't necessarily work for those who are suffering from sleep apnea or disruptive snoring. Nasal surgery, on the other hand, is recommended for patients whose snoring is caused by unnecessary blockage in the nasal septum. Tongue suspension procedure is a method that aims to keep the tongue from falling back. This is done by inserting a small screw in the lower jaw to which the tongue is stitched below. Shrinking of throat tissue is also a common method of creating solutions. Somnoplasty is a method that uses an electrode needle that releases energy to shrink the excess tissue. This then will be reabsorbed by the body. Surgery may not be a simple way of fixing your floppy throat muscles. But this procedure creates the ultimate solutions. Remember though that there are specific methods for specific causes. Be careful that you first discuss all concerns with your physician so that proper treatment is delivered to you. Stop snoring in children. Know the remedies before it's too late. Causes of snoring in children. Occasional snoring may be normal to children. Recent studies show that 3 to 12% of children between the age of 1 and 9 snores. But frequency doesn't mean normality. Habitual snoring can be a cause of a more serious medical condition called obstructive sleep apnea syndrome, OSAS, or simply, sleep apnea. For a mother, nothing can be sweeter than to hear her child's mumbling gentle sounds in his/her sleep. But if the sound is the minor version of the adult's snores, it might mean something else. Take note of this: for infants and children, snoring will always be a strange and deadly predicament. Usually, the typical causes of this are sinusitis or adenoid enlargement. Sinusitis can be cured by simple decongestants and antibiotics. Adenoid enlargement, meanwhile, will require surgery, wherein the tonsils and adenoids will be removed. Snoring for children, on the other hand, can possibly be an indication of obstructive sleep apnea, where breathing stops for 60 seconds at most, and usually followed with a snort or gasp. And the truth is that sleep apnea is more delicate for children than for adults. Parents should really pay attention to the possible sleeping disorder of their kids. The common effect of snoring for young children is that they could possibly suffer from nighttime and cough asthma. So if adults are recommended not to disregard their snoring, then how much more for children? There are also findings which claim that when a child in middle school shows lower academic performance, they are more likely snoring during this period. All of these presented facts are enough to convince the parents to take the necessary actions the moment their children show such symptoms. However, do not panic when such a situation happens. You can consult a physician first to ensure if the child has caught an illness related to snoring already. Meanwhile, if your child produces mild snoring, which is affected by certain allergy or illness, experts states that it can possibly be treated at home. More likely, the way you treat your cold. The following are suggested methods. Salt water. This is good to eradicate the blockage problems caused by the mucus. Though salt water nasal drops are available in drugstores, however, one can do a formula at home. Just melt a teaspoon of salt in 8 ounces of water. Sterilize the water by boiling it. You can place it in a nose dropper as soon as it cools down. You can also try to take oral decongestant intended for children. According to some doctors, decongestants don't actually cure an allergy or cold, but it relieves the symptoms. It may reduce the snoring since it helps the children enhance their breathing. When using this medication, be sure to have the right dosage for the child's age. Avoid products that include antihistamines. This can trigger snoring since this is identified to be a sedating medicine. Sedating medicines cut down the muscle tone of the throat's tissues since it tends to relax muscles and nerves. When the muscle tone falls down, the tendency is that it will trigger snoring. Observe your child as he sleeps, then seek for the best position where he can keep his airway open. Through this he will be able to breathe comfortably. M.D. Assistant Professor in the Department of Otolaryngology and Communicative Sciences and the Department of Pediatrics at the Medical University of South Carolina in Charleston, Lucinda Halstead, said that there are some children who are comfortable in lying on their sides while their heads support a little on the headrest. Keeping your children safe is one of your priorities as a parent. Taking the time out to observe them now would greatly diminish the chances of having bigger problems in the future. Bodily and psychological signs and symptoms. The actual bodily signs and symptoms. Among the really unusual problems how the whole subject associated with snoring encounters, is actually which, nicely, many people don't believe it is everything large of the issue. Consequently, lots of people are very suspicious whenever informed which snoring is really a serious bodily as well as psychological health condition. It takes only 1 minute, or perhaps a general look, in the listing of bodily signs and symptoms of a snoring issue in order to rapidly accept this particular humorous sound noun/verb to the course associated with severe health issues. Here's simply a good starting listing of the issues that may happen through snoring difficulties, as well as keep in mind, make sure you, which we are simply taking a look at bodily snoring difficulties at this time, psychological difficulties arrive later on. Cardiovascular disease, heart stroke, headaches during the day, because of low quality rest as well as bad airflow via trachea. Evening sweats, acid reflux, inflamed arms and legs, because of insufficient air circulation. A general destabilized defense mechanisms listening to reduction. When the snoring issue is extremely noisy, keep in mind, snoring is often as noisy like a moving aircraft. And much more. Additionally, the majority of us presume which snoring difficulties tend to be related to adulthood, as well as a result, how the bodily conditions mentioned over tend to be limited by grown-ups. This isn't the situation whatsoever, because so many kids as well as teenagers snore, especially individuals with associated airflow suppressing problems, for example asthma. Should you, the actual readers aren't the snorer, however possess resided along with, or even presently reside along with, an initial course snorer, many times yourself losing the rip or even two while you study this particular area. That is simply because frequently ignored within the entire snoring dialogue tend to be those individuals that do not snore. They are the actual partners, the actual spouses, the children, the actual childcare professional, the actual brothers and sisters, the actual in-laws, as well as the actual neighbors who've discovered on their own about the getting finish of the string noticed, or perhaps a yard mower, the actual seams of the snorer, which were known to begin from close to 10:00 p.m. hours, as well as ongoing, unabated. Till regarding 7:00 a.m. the next early morning. With regard to this kind of individuals, attempting to drop as well as remain sleeping wasn't basically a workout with intention dealing, it had been a workout within turmoil administration. The actual psychological signs and symptoms. It is never excessively spectacular in order to claim that the actual psychological expenses associated with coping with somebody having a snoring issue tend to be because serious, or even much more serious, since the bodily cost related to snoring difficulties. The reason being snoring can result in the troubling variety of psychological difficulties, such as sleep disorders, resulting in depressive disorders as well as anxiousness, relationship breakdown as well as separation and divorce, because of sleep disorders as well as insufficient sympathy. Keep in mind, the actual companion using the snoring issue does not frequently understand the actual discomfort that they're unwittingly leading to. Eviction with the landlord and also the ensuing embarrassment. This might seem humorous, however, many individuals possess actually already been kicked from their own houses for their snoring issue. Warring roommates as well as neighbors, work reduction, because of failure in order to focus as well as concentrate, due to insomnia. Storage as well as preservation difficulties because of insomnia. As well as inside these types of difficulties, which only an easy checklist, a whole guide could be stuffed in order to record the actual existence. Psychological harm brought on by snoring, really are a web host associated with unpleasant psychological says which invade both responsible snorer, and also the angered no snorer. These types of useless psychological says consist of aggravation, frustration, emotions associated with physical violence, helplessness, paralyzing desperation, aggravation, tiredness, developing bitterness, insufficient self-confidence as well as self-esteem. As well as let us remember the actual and incredible number of no snorers that generate vehicles or even run large equipment, with no strong night's rest. A number of them may, as well as sadly perform, place each on their own yet others in danger. Certainly, the actual psychological difficulties related to snoring tend to be, regrettably, much less talked about, particularly because the snorer themselves or even himself is not conscious which he/she is actually leading to a lot unintended psychological harm. However, as possible very easily observe maybe even within highlighting on your personal existence, the actual psychological expenses to be the snorer or even coping with somebody who has the snoring. Public relations. Snoring remedy tips. Put snoring to rest. Almost everyone can tell at least one joke about people who snore. But snoring's no laughing matter. According to the American Academy of Otolaryngology, head and neck surgery, severe snoring not only interrupts sleep, it can cause serious, long-term health problems, including obstructive sleep apnea. For chronic snorers, the good news is that they're not alone. OHNS says 45% of normal adults snore at least occasionally, and 25% are habitual snorers. Problem snoring is more frequent in males and people who are overweight, and it usually grows worse with age. The noisy sounds of snoring occur when there is an obstruction to the free flow of air through the passages at the back of the mouth and nose where the tongue and upper throat meet the soft palate and uvula. These structures striking each other and vibrating during breathing cause the sounds that keeps millions of people awake at night. OHNS attributes snoring to a variety of reasons, including excessive bulkiness of throat tissue. Children with large tonsils and adenoids often snore, inflammation and obstructed nasal airways. So what's a sleep-deprived person to do? Many doctors recommend products that relieve congestion or inflammation. For example, Z-Snore, from the spray line of sublingual sprays, can help with inflammation in the nose and respiratory tract, swollen tonsils, a stuffy nose and more. Developed by doctors, Z-Snore is a combination of homeopathic remedies that act gently and cause no side effects. It can be sprayed directly under the tongue or mixed with water or juice. The product meets all FDA guidelines for good manufacturing practices. Snorers and their spouses report dramatic results. The spray is amazing, says Melanie Doyle, 39, of Gardnerville, Nev. My husband snores, and I can't remember the last time I had a full night's sleep without having to jab him in the side to get him to turn over and quit snoring. The first time he tried Z-Snore, it worked. In fact, I woke up at 4:30 a.m. and checked to make sure he was still breathing. Follow these tips and stop snoring now. You have to stop believing that snoring is a sign of a good night's sleep. It's not. And it will never be. It may be cute in the first few minutes. After a while, it starts to sound as if woodworking is happening in your room in the middle of the night. And this is annoying. But if you have been snoring for days and your whole family cannot sleep, then you have to act now. Try these tips to put an end to their misery. Stop drinking and smoking. These two can cause you to snore and wake up the whole block. The reason? Alcohol causes a partial collapse on your airways which can immediately start snoring. Smoking on the other hand causes blockage on the small vessels of the lungs and swelling on the tissue in the throat and mucous membrane in the nose. Smoking can result to sleep apnea. Take note that if you stop drinking and smoking, you are stopping other health risks as well. Sleep regularly. Sleeping for few hours each night can cause snoring. Why? Unbalanced sleeping patterns develop into respiratory instability while asleep. And there is nothing good about respiratory instability because it can lead to unstable breathing. Hence, you need to regulate your sleeping patterns. Set a specific time of sleeping. Wake up in the morning on the same time, every day. Sometimes, 7 to 8 hours of sleep is all you need. Use anti-snoring devices. There are many of them in the market. You can get homeopathic throat sprays and tablets, throat sprays, sleeping pillows, or nasal strips and dilators. These devices help your air passage to relax and take in and out the right amount of air needed for a silent sleep. Cure nasal congestion and allergies. If there is an inflammation on your adenoids and your tonsils which are caused by nasal congestion, cold, or allergies, you have to take decongestant or antibiotics. It is simple, treat nasal congestion or allergies and you will stop snoring. Find a better sleeping position. Some people find it relaxing to sleep on the back while others are comfortable sleeping at the side. However, if the position you are comfortable sleeping in causes you to snore, better find another one. Sometimes, all you need to do is to change your sleeping position to open your airways and stop snoring. Lose some weight. There is nothing good about being an obese. It causes several health risks and of course, it causes that loud noise you create while asleep. Oh, lose some weight by getting regular exercise and eating the right diet, and living a healthy lifestyle. Steer away from snore triggers. If you are taking sleeping pills and products that contain antihistamines, then you are most likely a snorer. These are sedating medicines that relax the muscles and nerves. As a result, the muscle tone in the tissues of the throat relaxes and collapses. This triggers snoring just like the effect of cigarette smoking. Consult a doctor. Mild snorers can easily be cured. But there are cases in which snoring is a sign of other serious medical conditions such as hypothyroidism or diabetes that requires surgical procedures. If you are snoring for some time, this is the right time to consult a doctor. Home remedies. Tired of waking up in the middle of the night because of your bedtime partner's loud snores? Or do you ever wish your snoring would suddenly stop because you, yourself, is just plain tired of it? Well, guess what? Snoring can be cured inside your very own home. Here are some facts and tips to stop unwanted snores in your abode. Before anything else, what is really snoring and what causes it? According to studies, stertor, the medical term for snoring, is made from the vibrations of air, forced in a small opening at the back of a stuffed throat. Snoring occurs when we are sleeping, for while doing so, the muscles in our upper airway tend to relax and wilt inward. When these muscles relax more than the usual, our air passage is blocked, making it difficult for the air to pass toward our lungs. Our breathing stops for a brief period, apnea, thus resulting to snoring. During apnea, an increase in the level of carbon dioxide happens. Our body will react to it and it will affect our heart rate and narrow our blood vessels. The more these muscles relax, the louder people would snore. Some people are even unaware that they are snoring, with matching tossing and turning, and just waking up feeling tired and restless, or have poor quality of sleep. Some can even hear themselves snores when they are half awake. There are also many factors that may cause snoring. These are obesity, alcohol and smoking, enlarged tonsils and sinusitis, or blocked nose caused by colds. Changing lifestyles can help stop snoring. When you're overweight, an increase of fat deposition in our upper airways occurs, narrowing these muscles. The best way to stop snoring is through exercising and losing weight. Have time in exercising for your homes and eat a proper diet, or just change your eating pattern. Exercising is the easiest and most effective way in treating snoring in our homes. In exercising, concentrate more in your jaw because this is one of the common blocks that causes snoring. When your tensed jaw is relaxed, it would stop the snoring. If you have vices such as smoking and drinking too much alcohol, reduce them. Just minimize drinking, especially at nights, no harm done. No more snoring at nights and your health just took one step away from danger. Some studies also show that the position in our sleep also causes snoring. According to them, sleeping facing up blocks our airway passage. So it is advisable to change our sleeping position, may it be on the side or facing down, in order to get rid of our snoring. In children, enlarged tonsils, blocked nose caused by colds and upper respiratory tract soreness are major causes of snoring. When our nose is blocked, we tend to breathe through our mouth. This starts our snoring. So when you have colds, cure it immediately in order to avoid snoring. There you have it, some of the simplest home-based remedy for your snoring. It is really necessary to stop and find remedies in your snoring. This can affect our moods and our relationship to other people. The home remedies mentioned above are really great help to those who snore. They may not cure everyone's problems with regards to snoring, but they can minimize or lessen them. Of course, medicines and other devices such as throat sprays are used, but it has side effects and some are not that effective. It is still better to treat this disease naturally, no side effects, and no penny lost. Snoring remedy for a good night's sleep. The day has ended and the moon shines the dark velvet night. You gently close your eyes, slowly drifting to sleep, when suddenly, zzzzzzzzzzzzzzzzzz. That sound is definitely not music to the ears, and much worse, you have to bear with that irritating noise until morning. Snoring itself can be harmful to a person, and so is lack of sleep. So before you reach this point, get an early start. Persons who snore are not much bothered with the noise that they make, but their companions are. That is why the remedy for snoring is much sought by these people. Snoring can be harmful to one's health in the long run, which is why many individuals are looking for the best snoring remedy that is available. Snoring can affect the whole family, because the annoying sound reverberates all throughout the household, especially during the night when all things are pretty quiet. Depriving your family with their night's sleep is not a very good thing to do, and the least you can do is to stop snoring. But how? There are many snoring remedies out in stores. Snoring aids and sleep aids are available at a reasonable price. If you've been snoring for a long period of time, perhaps it is time to seek professional attention. What most people don't know is that snoring is a major symptom of sleep apnea. Sleep apnea is a serious condition which needs considerable professional attention. Many people die from this condition because breathing stops suddenly while a person is asleep. Persons with sleep apnea should seek medical advice immediately. You can observe that the person struggles momentarily, catching their breath after snoring stops for a few seconds. Some snoring remedies include 1. Nose strips 2. Special pillows 3. Dental appliances 4. Acupuncture 5. Hypnotism. The causes of snoring vary from one individual to another. Others snore because they are overweight, while others claim that they snore because of certain food intake. If you're overweight, perhaps it's high time that you reduce weight. You can start by getting a daily exercise, or you can work out in a gym. If you eat foods which trigger snoring, Start monitoring all the food you've eaten for the day. A change in lifestyle is the best solution if these are the causes. Although it might be difficult at first, you will get used to it after some time. The sleeping position also triggers snoring. Sleeping while the mouth is open, or lying on the back causes snoring as well. There are sleeping devices which you can use at night to support the jaw and will keep your mouth closed. Others lie on their side to avoid snoring. You can also inhale steam before you go to sleep. Your nasal passages will open up, and you will find it easier to breathe on the nose. You can also use a system of air filtration, to be rid of allergens like pet hair, dust, and cigarette smoke. People are always looking for the best way to stop snoring. To completely stop snoring is quite impossible, but remedies can lessen the snoring scenario every night. There is no best among the best, all you can do is to find the best remedy that will work for you. Consult your doctor first before you use any special device. Seeking medical help is the best way to deal with snoring. Stop snoring remedies, from nasal sprays to surgeries. Snoring would have been nothing if all people sleep alone in their solo beds, away from anyone that could hear. But as we all know, most of us have bed partners who often get annoyed with sleep-disturbing noises. Good thing, there is already a wide spectrum of stop snoring remedies that may find yours, or your partner's, relief. Nasal sprays are normally used by mild snorers who would not want to get bothered with attaching nasal strips and clips at night or of taking the permanence of nasal surgeries. While reports on the use of nasal sprays vary, it still shows that some snorers find good use in them. Nasal sprays work by tightening and lubricating the muscles surrounding the throat and the mouth. This way, the vibration caused by excess muscles would be set off, thus the production of sounds can be prevented. There are no definite claims on the lasting effects of such sprays, so they would only be effective so long as the use is continued. Nasal sprays are not only helpful for mild snorers. Snoring may also occur due to change of weather, diet or any factor that can trigger its causes. Such cases can be resolved through using nasal sprays. While most stop snoring remedies focus on the obstructive tissues that cause the blockages in the air passages, there are those that resolve things through keeping the outside mechanisms from triggering the snores. Chin cushions and chin straps will keep your mouth in place. But how does keeping one's mouth close helps against snoring? Well, there are types of snorers who breathe on their mouths. Mouth breathing is known to be one of the many causes of the vibrating sounds during sleep. It has been observed that once breathing is shifted towards nasal processes, some types of snoring can be helped. When one's mouth is open, the jaw will drop, thus creating space where the tongue may fall back towards the throat. When this occurs, vibration is possible. If one's tongue is kept from collapsing, it is less likely that the throat would produce snores. The chin strap works by holding the jaws together, which prevent them from falling apart. Chin cushions, on the other hand, have the added benefits of preventing the head from dropping forward. This way, easier breathing can be facilitated since the airways are wider when the head is kept back. Taping the mouth can often be awkward, but this does not necessarily mean that the technique is ineffective. Chin-up strips are tapes worn beneath the mouth to help redirect mouth breathing towards nasal breathing. The advantage of which is that it does not prevent the mouth from moving freely through covering it, but it lays its support at the bottom of the lip. Thus, one can sneeze, cough and breathe in the mouth at will. The disadvantage though is that when this occurs, the effectivity of the chin-up strip is lessened. All stop snoring remedies mentioned here are just aids to relieve you from the troubles of snoring. They can't exactly cure your condition. If you want permanent solution, the best option you may run to is surgery. Be careful though that long-term effects, and possible damage, go with this decision. Careful examination of your condition must be delivered and thoughtful decision-making must be made. Safe and effective home remedies. While some ailments require specific medications, others may be treated with simple home remedies that have withstood the test of time. Generations ago, people began using home remedies and have passed their knowledge on to their families as time progressed. Still, many are unaware of the large number of home remedies that can provide instant, safe and effective relief. Best of all, home remedies do not cause side effects as other conventional medications often do. Anyone who suffers from allergies or a cold may find themselves increasingly congested throughout the night. In order to relieve breathing and open the airway passages, an individual may find success in running hot water in the sink and slowly inhaling the steam from the running water. This will help to relieve blocked nasal passages and may help the sufferer to breathe easier at any time of day, including at night. Snoring is a big problem, but few know how to treat it. In addition to a number of anti-snoring devices, medications and even surgery for extreme cases, there are also a number of home remedies that may help to eliminate this nighttime nuisance. Anyone who snores may find that sleeping on their side, instead of their back, may help to eliminate the problem. Adding an extra pillow may also help to curb snoring due to the fact that the head is raised slightly higher and may help to prevent air passages from becoming restricted, which is a leading cause of snoring. In the event that snoring worsens or does not seem to respond to home remedies, it is possible that the individual has developed sleep apnea. This is a serious condition that requires immediate medical attention. With warmer months just ahead, the bees will be buzzing and this means the potential for bee stings. To lessen the itching of a bee sting, a combination of baking soda and water can be combined to create a paste that will ease some of the discomfort. Many individuals find this to be just another part of summer, but to others, it can be life-threatening. For people who are allergic to bee stings, medical help are not always close enough. Therefore, over-the-counter Benadryl is often recommended as a temporary aid to keeping the allergy under control until the bee sting sufferer can get to a doctor or hospital for further treatment. Individuals who are allergic may find that carrying Benadryl with them is a good idea. Everyone is scared of the dentist, but it's a part of life that everyone must face. Whether a recent tooth loss, cleaning or other procedure that may cause bleeding, rinsing with warm salt water on 2 to 3 occasions daily will help lessen the chance of infection and will ease soreness. Anyone who paints their fingernails is probably familiar with the smell of nail polish remover. Well, for anyone who finds the smell unbearable or simply feels lightheaded in its presence, there is a much simpler way to remove nail polish. Simply applying clear nail polish to each nail and allow it to sit for 3 to 5 seconds before wiping it away with a napkin or paper towel. This will help to remove any trace of nail polish. www.adultsleepapnea.com